Welcome to the TNA Nursing Student Hub Minute, a segment of news lasting under 10 minutes. We get the problem with the title, but hear me out. Think of it as Dollar Tree, with 98.9% of their items being more than $1. There was a time when Dollar Tree, never mind. The 89th Texas Legislature is underway, and decisions made during this session will directly affect you as a nursing professional. Here's TNA's Director of Government Affairs and General Counsel, Jack Frazee, with more.
One of the bills that we're focused on this session is trying to clean up the Texas nurse staffing statute. Basically, this is a law that was originally passed in 2009. It requires hospitals to put together staffing committees made up primarily of nurses that are on the front line doing bedside work. And then that committee comes up with policies for the facility and a plan for how to staff that gets sent up to the governing board of that organization. The point of it is to have nurses directly involved in deciding how hospitals will be staffed and then make sure that that staffing is adequate so they're not spread too thin. That statute ends up getting backed up by something called the prohibition on mandatory overtime. If you work overtime hours or you're required to do that, that's illegal in the state of Texas. And so that's meant to be a backstop that then forces hospitals to use the staffing statute to come up with plans and policies that fill the needs of the hospital so that they don't have to do mandatory overtime. The problem is that law actually gets suspended if there is a public health emergency declaration. And we had an emergency declaration for over 3 years during the course of COVID. So staffing as a system in Texas just completely fell apart. So one of the bills that we are working on this session is to beef up that staffing statute and make sure that it's properly enforced. The current law as it stands allows you to collect a bunch of data that's reported to the state by hospitals about whether or not they're complying with the statute. And so we requested all of that data, and we found that in any given reporting year, there's about 5% of hospitals that tell the state they don't comply. So we are trying to figure out, what do you do when somebody is non-compliant? And the response that we're getting from the state is, well, we don't really do anything. We don't use this data to inform our enforcement efforts. So one of the core priorities of this bill is to change the existing law, require the enforcement division of the state to actually use the data that's being reported, and then use that to investigate hospitals that are non-compliant, give them corrective action plans on how they can become compliant, and assess penalties when that's necessary. There's several things nurses can do to help push this along. First of all, once we get a bill filed by a legislator, we will be sharing information about that on our social media and on our websites. It helps to know what bill is pushing what priority. Once we have a bill of that sort, you can call the bill author and tell them that you're supportive of the effort, that you appreciate them working on it. You can call your own representative and senator and tell them that you're supportive of the bill and that you want them to move it forward. You can also come to Nurse Day at the Capitol. That's an event that TNA hosts that allows us to go en masse and speak with all of the members of the legislature in one day. And that ends up really elevating the discussion because I can go and talk about the policy and the legal minutia, but it's nurses' lived experience that actually puts some meat on the bones. So we really need nurses to come and talk to their legislators so they understand, how does staffing affect you? Have you ever been in a situation where you were understaffed? And then how did that impact patient care? Because the reason we're focused on this is twofold. We want to make sure that nurses have a good working environment, but we also want to make sure that patients are taken care of and that they're safe. And there's a lot of research that shows that if you have insufficient staffing, you're going to have bad outcomes for patients.
Nurses will have the chance to show up and speak out during Nurse Day at the Capitol, March 3rd and 4th in Austin. During the event, nurses visit their congressional leaders and talk about what issues are most important to Texas nurses, as Heather Hill, faculty member with Galen College of Nursing, details.
For me, it really is, what I love is the Nurses Day at the Capitol, which isn't necessarily a TNA thing or an organization thing, But the fact that they, when I went, that they prepared me. So I kind of knew the issues, right? But TNA gave me what those actual written issues are and which bill is tied to it, and prepared me to have a conversation that I could have with my congressman and my senator. But then now I felt like not only could I have that conversation then, now I can have it with everybody because now I really understand the issue, right? And so before I might be able to complain about an issue, and now I can say, and here's what we can do about it, right? And here are what we're working on. And so it gave me the context to to discuss those issues at a higher level, and really it was a very big aha for me the first time I went.
TNA will be here all session to keep you in the know. This has been your Nursing Student Hub Minute.